Hi, listeners. So happy you're here, practitioners. Welcome to Functional Medicine 2.0. And we're talking today about, is energy medicine real or just expensive air? I have so many things to say about this, things I love, things I don't love. And I've got Camille in the house today. Camille, can you say hi and just tell them a little bit about you?
Hi, thank you so much for having me, Dr. Z. I'm super excited to be here. I'm an acupuncturist by training. I'm also a functional medicine trained health coach. So I also have a lot to say on the subject of energy medicine. I'm excited to get into it.
I love it. I'll tell you a little bit about my background because, the title sounds like, oh, we're just going to crap on energy medicine. And there's some things I have to complain about, and there's some things that I think are good. But my background is I wasn't drawn to it. I can tell you that much. I was into, all the science, the hardcore data, what's proven. And so here's the thing, though, that interests me is I always try to also learn the thing I'm not drawn toward.
Oh, I love that.
So like when I first started in practice as a DC, I did chiropractic biophysics, which is has a lot of research published, very data driven, and how we worked. And that just really resonated for me and made a lot of sense. But to try to be as well-rounded as possible and make sure I could serve people, I then went for what I considered was the most woo-woo, what the heck, I don't even get what they're doing approach ever, which was network at the time. So if anyone out there knows, so I worked in both practices at the same time. They could not have been more different. And I still brought my mind to it, which means when I went and took that training, first of all, I was hanging out with all the activists, character codes, and all the people who are naturally drawn to this approach, and I stuck out like a sore thumb. But it was like, all right, if I'm going to do this, then what's the method? What's the protocol? How do I break this down into a system? But then I did it. And times I was wondering, like, am I doing anything? Like, what the heck is happening here? I really had to get down into the nitty gritty science of it as much as I could, because I couldn't do something unless it felt like something real. And so I worked in a practice, and I was actually really good at it. I was really good at it because I took that mindset of how to break it down and made it into something that was actually repeatable, and saw people get results. And I could explain it the best I could. Could I explain all of it? No. And that was the start of learning, well, maybe there are some things that work and we don't know how to explain it all.
Yeah,
but that
for
was my
sure.
first start with energy medicine. How about you?
Well, I became an acupuncturist kind of really out of nowhere. Like it just became, I had my first acupuncture treatment, and then I was graduating from college at the time, and I was like, okay, this is what I do now, and went to school. But like you, I have a very kind of scientific mind. And even all through my career as an acupuncturist, it was really hard for me to grapple with the things that I couldn't explain scientifically. Then there is some research around acupuncture, but I always had a hard time wrapping my head around the things that we didn't know. I couldn't explain exactly how it worked, but people got better. And so that's kind of what I always focused on. And then through my career, I would be exposed to other things that patients would try. And I started to come to the idea of there's a little bit of something to everything. So there's nothing that I'm going to automatically just poo-poo, that's ridiculous.
Right.
That couldn't work, because I don't know. I think the world's kind of a crazy, magical place.
And results do speak loud. And like I said, it's never something I've been drawn for, but it's something I would always engage in because I didn't want to miss something just because of my bias or being narrow-minded. And I always started with my own healing, but then how did that apply to patients? So another experience I had was working with a woman. This was in the San Francisco Bay Area, and she would teach all the energy workers. So it was every technique, you name it, she had the certification in that, and she taught them. And she would explain to me, so I'd go see her as a patient. She would explain to me some of the science behind it. And sometimes I'd be interested. And sometimes it was this was my treatment. This was different. I wasn't learning this to take care of patients. This was for me. And I was like, I don't care. Just do whatever. It's surrender my body to the moment. And it was really interesting to have those experiences and see how it worked. So it was something I would keep in there. And just like I would use traditional medicine, I would use functional medicine, I would see every practitioner under the sun. I was dealing with complex issues. I would keep the energy workers in there. And a lot of times I would absolutely have to combat my own skepticism. And then something happened later, and I was like, "Oh, this is why I'm skeptical. This is part of it." First of all, I value certainty, right? And so
Sure.
again, we don't have answers for everything. Even in traditional medicine, we don't. But it was one of my first functional medicine practices. I was working with a patient, lovely lady, and really would have these challenging responses to anything. And sometimes what seemed so contrary, like you knew this approach you were going to use was very scientifically founded, very benign, shouldn't have any weird responses to it. You'd seen it work hundreds of times, and she would have this paradoxical response to it. It's like, what is happening? And so it got to the point where I said, listen, I think I've taken you as far as I can take you. I don't know what to do next. Let me refer you to someone else who I don't understand what they do. And it was one of those energy workers. I don't understand what they do, but maybe they'll see something I don't see, and let's see what comes up. And she said to me, well, but I trust you. And I said, well, I don't know how to do this. And she said, I'll wait.
Oh, I love that. I love her.
I know. I'll never forget it. I was like, what? And so literally for her, I went and learned how to do it.
Wow.
And so this was like nutrition response testing, MFT, energy testing. And again, I find myself in a room with people. I stand out like a sore thumb. I've published research, right? Like I do not fit in there. And I am so like, what are they doing? And they're showing stuff on stage. And I'm like, this feels like performative theater. And so I just have those skepticism bones just deep in there, right? I'm like, they're a cult, all
Right.
these negative thoughts for real. This is really what I'm thinking. But I went up to them and I said, listen, tell me what I have to do. If this can do something, really, what do you have to do? This is like on a Saturday, right? A Saturday training. What do you have to do? Because I have a patient on Wednesday, and they go, what? People train for this in years. I'm like, well, I don't know what to tell you. I have a patient on Wednesday. And so they taught me some stuff there. Again, same approach. I had to translate it into a system I could work with. I practiced a little bit on Monday, and then I saw that patient, that same woman, on Wednesday. And I told her, listen, I just learned this. I don't know. Is anything going to happen? And when I first started working with her, it's a subtle art. And I acted like I was moving a couch. That's the truth. But to my shock, we were actually able to learn some things and finally put together a protocol that she did not have a negative response to. And I was just like, what? How did this happen? And I thought it was so weird. And so because I thought it was weird, this was not natural, and I think it's good to learn things you're not normally drawn to. I took more courses. I learned more stuff. I definitely did it differently than they did it. I started running labs and testing it. And I actually did it with thousands of patients while I did full exam and labs and did the energy woo-woo stuff and compared it. And then I actually taught other people. So that's how far I took it. And I'd be lying if I said I didn't see some really interesting results.
That's really, really cool story.
Yeah, it was wild. And when I went, and I had some people come to me just for that. And it was interesting because when I did the explanation for it, I'd be like, this is going to seem weird. I think it's weird too. But here's why I'm doing it, And so I just was honest about the feelings behind it. But here's why I'm doing it. Here's what I'm going to learn from it. And what I think part of the challenge is it doesn't work like inter-practitioner. Everyone has a unique style. And I didn't see it. This is why it's not measurable in the same way. You can teach methods, you can teach techniques, but it almost reminded me, here's how I describe it. It was like a blood pressure cuff. If blood pressure, it's like different office to office, I swear, and everyone is calibrated a little bit differently. And if you have a blood pressure cuff that's off, you're not going to get that true reading. But if that practitioner is using that blood pressure cuff, even though it's off, but they use it over and over and over again with all these patients, they're still going to see trends up or down. And so then it actually becomes a reliable tool for that practitioner, even though it's not inter-reliable from one practitioner to another. They're not going to see the same thing and get the same results. And you have to be so careful not to bring your bias in. Like it's really challenging. So it was an interesting tool. Like I said, I went deep into it so I could learn. I think where some of the skepticism comes from and where I had problems is people teaching like that's all you need. I didn't like
Right.
that. I didn't like these scenarios where people were like, I'm going to do muscle testing or applied kinesiology, and I'm not going to ask for a history of the patient. I'm not going to look at labs. I'm not going to look at human behavior. I had a problem with that. I felt like this could be a valuable tool, but I don't like it as the only lens.
Yeah, and there's so much of that in these kinds of alternative where it's presented as a cure-all, that it's going to fix everything for everybody. And that for me is always going to send up my red flag of like,
Yes.
is it though?
Yeah, look, I don't throw everything out. If you
Right.
found a new tool and you're awesome at it and it's helpful, I love that. I mean, I learned some of the weirdest things. I remember a patient. I was like, and we've known for a while that she had a true allergy to oats,
Hmm.
and so I was doing this energy work on her, and I said, "What's going on? I'm getting oatmeal." And she's like, "Oh God, I swear to God, my body just rats me out to you every time. I ate oatmeal cookies last night. I wasn't going to tell you, Dr. Z." I'm like, I don't know what to tell you. There's just the weirdest things. Once this chemical came up and it was so weird, I didn't even know the ingredient. I didn't know what it was. I had to look it up. And so I'm literally in the visit pausing and go, it says PVC. Why? And she goes, are you kidding me? I replaced all the plumbing in my house with PVC pipes 6 weeks ago. You
No
know,
way.
I'm not kidding. And I'm not a magical woo woo girl.
Right.
And just the wildest things that would happen. But there's no way in heck. And I was like, who's benefiting from learning this, like teaching that that's all there is? I have a problem with that because
Right.
there's times things would come up with that energy technique. And I was like, no, we're not going down the path. The lab indicates something different. I know this patient's history. You know what I mean? Like, absolutely, a discerning mind always had to be there. But I think it's the training companies. It's the people making bucks off of you. They want you just to use that system. We always have to graduate. There's a new system you have to learn now. There's a new test kit and all that kind of stuff. And it would be harder to tell people. Like it's easier for them to make money and tell people, this is all you need. You can ignore everything else. You can
Right.
have a practice. Just see these people just do this. And I think it's irresponsible. I
It's
think
easier to
that,
shell out the money if you're like, this is all I need.
yeah, and easier to get started and great. I'll just do that and ignore everything else. And it
Right.
could still have value too. But I just feel like the ultimate responsibility is to that patient. And that's not enough of the picture. So I know I'm going to piss some people off and I'm sorry. It doesn't mean there isn't, value to your energy technique, but I think we still have to look at the whole person in front of us. If you're really only going to do that one technique, then please at least don't tell the patient this is all you need.
Mm.
At least say to them, here's what I do, and I'm one small piece of the pie, but please make sure you're seeing this practitioner and you're paying attention to that, because I would get patients that would say, oh, I have this condition or this illness or this disease or this infection because the energy medicine practitioner told them that, but it didn't prove to be accurate.
And that's what I love so much about that story is that you put the patient first. You had this initial bias of like, that's ridiculous, that's woo-woo, that makes no sense. And instead of just leaning into that, you asked yourself to step outside your comfort zone and try it. And if you didn't resonate with it, you wouldn't have done it on the patient, but you did it and that person had good results.
Camille, let me tell you, I did not resonate. I felt so silly. I felt so foolish. I really did. But all I cared about was them getting results. And
Yeah.
so if this could help, let me try it and see what we learned. And it did help. And so I
Yeah.
was like, all right, I'm going to keep testing this. I'm going to keep, learning. And that's why I say, it does have value. And I don't want to pretend that all energy medicine is expensive air. I don't think that's accurate. I think it can be, and you have to look at who's the individual delivering it and who's teaching it. I'll give you an example here. I'm in Playa del Carmen, in the Caribbean coast of Mexico, and there's some wonderful, things that are available here. Like I go to a stem cell clinic 3 times a year, and it's really helpful living with a primary immunodeficiency. Now it's run by MDs, and I'm mixing traditional and alternative and functional. I'm mixing all, regenerative medicine. I'm putting all these things together, and that works for what I need, right? And I'm not going to not take antibiotics if I need it. I'll try to not need it. That would be great. But if I need it, I'm taking them, right? So I'm never doing anything like that. One of the techniques I'll use is ozone treatments at times. It has to be used in a certain way. And sometimes people don't know that you need to like get a concentrated amount of short time to actually see benefits. Otherwise, it doesn't do much. But there was someone here who was saying, oh, for damaged meniscus and like knee, bone on bone, get ozone treatment. And that's not going to do anything for that.
Right.
And so that's where I think also, there's just scam artists out there, and there's people who give things a bad name, and ozone can do a lot of good things, and it has to be used judiciously, but it's not going to rebuild cartilage.
Right.
It's the wrong recommendation, and that person's just, the layperson doesn't know. So there's a responsibility. And I hope, practitioners, like you're going to do a good job and you're going to be ethical. Unfortunately, not everyone is.
Right. And that's true across alternative medicine and conventional medicine. You can have the best MD, and there are some MDs that really are not practicing great medicine. Thank you. Yeah. And same thing with any modality, right? You can go to a massage therapist who's going to mess you up, or someone who's going to make you feel so much better, and so you just have to do your due diligence with your provider, I guess.
Yes, 100%. And I think that is where energy medicine can sometimes get a bad name, because sometimes are people really doing a technique that helps you, or are they waving their hands and using their personality and charisma and trying to fool you into it being something good? And unfortunately, like you said, there's going to be charlatans at every level. And so you get some charlatans in energy medicine, and you need to be cautious and make good choices. The wrong response, though, is to then cross your arms and say, well, none of it works and nothing's out there for me. Same thing, bad MD. You don't want to then say, well, everything in traditional medicine sucks, because that's not true either. Right. But yeah, I get a little pissy about the ones out there that are just waving their hands around and like, yeah, this is a great way to make money, and they're not really doing anything. When most of the energy medicine practitioners I've met, they care very deeply about helping. They're highly intuitive. And many of them have spent years, if not decades, studying their craft. And so then those charlatans just give everyone a bad name.
They do. Yeah.
So I don't like that experience. And you're trained as an acupuncturist. What about that? Some of the acupuncturists I've met, they've been in school so long. And people don't even realize, it's a 5,000-year-old form of medicine.
Yeah.
And how much they've learned. And I'm mystified by how, like in traditional Chinese medicine, there's things they figured out before we understood the physiological, reason for it, like the liver hour, and then glycogen dumping, and how cortisol signaling from the adrenals and what's happening with your blood sugar at night. But 5,000 years ago, before we knew any of this science, they figured out that the liver hour. How?
It's wild. It's wild. I mean, even just looking at the chart, looking at the body chart of the meridians and putting that next to the vascular and nerve channels in the body that we now know where they are, and they line up really nicely. That's crazy.
I remember a pain, and I love chiropractic. I can't imagine like having raised a kid without chiropractic and going through life, getting put back together and all the other benefits, immune support, all these things, right? I had a car accident many years ago, and I had this pain right in the middle of my back, and it hurt so much. And my first thing is to go to a chiropractor, right? And so many things it has handled, but nothing would touch this pain. And I was doing everything. Saw an acupuncturist, boom, gone. Didn't come back again.
That's awesome. I recently started going back to an acupuncturist for myself. And one of the things I was looking for in an acupuncturist was someone who did craniosacral therapy, which I had never tried before. And I was also very skeptical. It sounds very strange. She just puts her hands like on my head very lightly. and I have some jaw stuff going on, and she's touching my head like this, and I have my hands on my head for people who aren't watching, but I feel this massive stretch in my jaw. And I mean, she's one of the ones who she's so legit. She's studied for years. She's got a gift for this kind of medicine, but every time I went, I had some sort of experience like that where my eyes are closed. I don't know what she's doing. And after I would ask her and she'd say, well, we did this big kind of opening. And I'm like, I felt like you were stretching me. I mean, and it sounds insane. I like to say it. I'm almost embarrassed to be like, this is what I felt.
Love craniosacral work.
I do.
And for someone who's not woo-woo, I've actually studied it a fair amount and how it works, and cerebral spinal fluid and parasympathetic waves and the whole thing. It's actually quite legit when done correctly. And I'll tell you, my husband is a trained massage therapist, and he went to, Northwestern Health University, I believe, in Minnesota. And so there's a lot of different techniques that he learned, and he's an activist character code, so he's more drawn to that energy medicine. I'm not, but there's absolutely times where I'll be like, oh God, I feel like crap. Come here, do your woo woo stuff. Just fix it. Just point to it. Fix it. What's going on? Yeah.
Tap into my energy.
I don't want him serving me up supplements though, because he'll just go and grab random stuff, and I'm like, no, don't do that. I'm not interested in that.
Wave his hand over it and then hand it to you.
Yeah, no, that doesn't do that. That's not the right thing. But here, my tummy hurts. Fix it, would you?
Yeah.
So absolutely, we do need these people who understand hands-on medicine for the body and energy. I mean, energy's there, even for the person who's not woo-woo. One of the things I would think of is like, have you ever had someone walk into a room and like your back's to them, but all of a sudden like the hairs on the back of your neck go up? Like, there is energy all around us and things that, are impacting us, even if we don't notice it and we aren't sensitive to it. So I'm the wrong person. I can't explain it all. And I'm very critical and very skeptical. That's the mind I bring to it. But I force myself to stay open to still trying things for myself and learning things for myself. So that's sort of the final take. I know that's not a perfect answer, but I think it's my end all be all for everything is what works, what helps people get better.
Yeah. Absolutely. That's what it's about.
All right. So listeners, I'd be very curious. What's your take? And I know some of you are energy medicine practitioners. You might have a lot to say about it and it might irritate you, but that's okay. If my challenge is to stay open-minded to learning some of these things, then I would say your challenge is to stay open-minded to the other side also. And let's see how we can have that conversation together. Keeping in mind the functional medicine 2.0 approach, which is what works for the patient, what's going to get them those outcomes they need, and results speak the loudest. So Thanks, Camille, for being here. Super appreciate it. Thanks for all the listeners, and we will talk again next week.
Thanks for having me.